My name's Leah Petit, and I'm doing my visibility report on telehealth and how it can impact lives in Wisconsin. This is my audience. Alright. Can OTs use telehealth to impact lives in Wisconsin? Patients could get access to faster health care in Wisconsin through telehealth services. Telehealth is done virtually so that patient can get treatment in comforts of their own home. Telehealth can be done anywhere, anytime, and services can be provided to any age. Getting access to all kinds of health care is getting more challenging to receive inside the office. Making an appointment is becoming even more difficult due to clinics being oftenly booked. Some places you can't even be seen for several months out. Telehealth is becoming a more popular option amongst people that live in rural and urban areas, as well as patients with limited mobility. If patients could receive telehealth services, then more people can be treated in a timely manner. Through first, state regulations and reimbursement would have to change. The conditions that telehealth can benefit are through cardiovascular disease, mixed chronic conditions, diabetes, behavioral health, mixed conditions, physical rehabilitation, respiratory disease, surgery support, burns, dermatology, and premature births. You can all see the visual. Alright. Since telehealth is done virtually, patients don't have to experience delays in care, as well as drive in horrible weather conditions. Also, another benefit is it reduces healthcare costs because less patients are spending their time in the hospitals. And the communication between the healthcare provider and the patient is more effective and more beneficial because they have more time to talk to them one-on-one. For reimbursement, Medicare and Medicaid are two of the types of insurances that are still not covering telehealth services for occupational therapy. Due to this, American Occupational Therapy Association is trying to advocate for more Medicare and Medicaid to cover reimbursement for these telehealth services. Some interventions that OT are doing are fitting people for wheelchairs and other mobility devices such as canes and walkers. They also can provide education on technology to use with bathing, dressing, and grooming. And then people for the geriatrics that may have diabetes, they teach them how to self-manage their blood pressures and all that. And then also medication management. And then for people with mental health issues disabilities, they treat them with they help them find coping techniques. As of right now, the regulations for Wisconsin is that only occupational therapy registered therapists can do all the evals and not the OTA. Also, the OTA has to be supervised under the occupational therapy registered therapist. My findings prove that occupational therapy telehealth services can impact lives in Wisconsin due to the benefits and interventions it supplies. So thank you for everyone to listening to my presentation. If you would like to show the audience one more time, and then we can end the
Mm.